We are learning about ways to prevent and even reverse type 2 diabetes with Dr. Miles Hassell from greatmed.org. So you can reverse type 2 diabetes with diet and exercise. Tell me more.
Yeah, most cases of type 2 diabetes, probably 70% or more, with appropriate diet, appropriate weight loss, and appropriate fitness levels, 70% or more of people with type 2 diabetes don't need to have the disease. And the importance of that is that type 2 diabetes is an enormous contributor to illness in our country. You know, the downsides for eye health, heart health, stroke risk, kidney failure, all these kinds of things. And then there's the problem with the cost and the side effects from all our medications. When they're necessary, they're great. I'm not anti-medicine, but when you can avoid them, why wouldn't you avoid those medicines? Because of the expense and side effects. And so I would argue that most people with type 2 diabetes with even a 3 times a day exercise program, it might only be 1 or 2 minutes, something that makes them breathe hard, appropriate diet where they really reduce refined carbohydrates and stick to what we call a Mediterranean style whole food diet. So most foods made at home, I'm afraid, so you have to cook. And waist loss. So we don't talk about weight loss, we talk about waist loss because it's the weight around the middle, your midsection, that seems to contribute the most risk.
And why is that where it always seems to go?
It's not fair, not fair.
It's not.
Yeah.
You're an internal medicine doctor at Providence St. Vincent and have been for many years. What made you want to start the website greatmed.org?
Well, greatmed.org exists because we think that most illness can be prevented by good lifestyle choices. Not all. There is still a value in doctors like me and others, of course. But if we can train people on staying fit, eating well, and keeping their weight under control, we can reverse most chronic disease. We can prevent most chronic disease, not all. But if we can get that information into people's hands, reliable information that's not based on some ideology or some drug company or some nutritional supplement company, then we think we'll really help a lot of people.
And you wrote an entire book on the subject.
Well, as a matter of fact, now that you bring it up, I wrote with my sister, Good Food, Great Medicine, which is now in its 4th edition, and it tries to encapsulate all that.
To get your copy of Good Food, Great Medicine, and to learn more about disease prevention, visit greatmed.org.